Airway obstruction, or choking, can cause death within minutes. Coughing is nature's way of clearing the patient's airway. If a choking child is coughing, do not interfere and encourage him or her to keep coughing until the airway is clear. This is called a partial airway obstruction. If, however, a choking child cannot breathe or cough, you are dealing with a complete airway obstruction, and the patient requires immediate assistance. The patient may grab the neck with one or both hands, making the universal choking sign. If you witness this signal or suspect that the patient is choking, you must act now to clear the airway. The airway may be cleared by two methods: back blows or abdominal thrusts. Back blows should always be attempted first, as they cause little or no harm, whereas abdominal thrusts may cause internal injuries. If abdominal thrusts are used to clear an obstructed airway, the patient should always be examined by a doctor. When providing back blows, stand behind the child and tilt the child forward. Support the child in front with one hand. With an upward direction, strike the child between the shoulder blades with the heel of the other hand. This should be performed as forcefully as possible. If back blows are unsuccessful, you have to resort to abdominal thrusts. Stand behind the child and place both your arms around the child's abdomen. Locate the child's navel, halfway between the waistline and the breastbone. Place the fist of one hand just above it. Grab your fist with your other hand and give a quick, forceful inward and upward thrust. If the abdominal thrusts are unsuccessful, revert to back blows. Repeat the sequence of 5 back blows and 5 abdominal thrusts until the obstruction is expelled or the child becomes unresponsive. If your attempts to relieve choking are unsuccessful, or the child becomes unresponsive, send someone to activate the emergency medical system by calling 112 or 999. When the child becomes unresponsive, perform 1 cycle of CPR. Each time you open the airway to give rescue breaths, look for the obstructing object in the back of the throat. If you see an object, try to remove it. If unsuccessful, continue CPR 1 cycle at a time, checking for the object removal following each cycle. Your instructor will now take you through, in your groups, the steps of foreign body airway obstruction procedure for children.